Welcome to Griffonomics. For decades, neurosurgery has been this brutal, almost medieval compromise.
Yeah, it really has.
I mean, when you really think about the historical reality of it, you're talking about bone saws, you're talking about heavy drills and highly invasive hardware just to, peek at the human brain.
It's massive physical trauma.
Exactly. But today, I want you to imagine taking that entire surgical suite, like the mapping tools, the ablation tools, all the monitors, and shrinking it all down into a microscopic, flexible film, a film that can literally be delivered deep into the brain through a tiny needle.
No bone saws.
Right, no massive incisions, just a completely seamless interface.
Which is a complete paradigm shift, honestly.
Mm.
And what we are looking at today in this deep dive is the tiny, 16-person company making that science fiction reality possible.
NeuroOne Medical Technologies Corporation.
Right, or NMTC. And to build a comprehensive investment roadmap for you today, we're pulling from a pretty dense stack of sources. We've synthesized their definitive proxy statement, the Form DEF 14A from March 2026.
Essential reading.
Very. We are also pulling critical insights from a recent investor webinar transcript featuring their CEO and CFO, and, layering in some strategic investment analyses.
And the mission for today is highly specific. We are exploring exactly how this tiny David of a company is fundamentally disrupting a multi-billion-dollar neuroelectrode market.
A market dominated by massive Goliaths, I might add.
Yeah, exactly. To understand how they plan to pull that off, we first have to understand the foundational physics of their technology. It all starts with their transition away from traditional rigid hardware to a proprietary thin film platform. Okay, let's unpack this because the mechanical difference here is just staggering.
It really is.
Think about traditional legacy neuroelectrodes. For a long time, the industry standard has essentially just been rigid, insulated metal wires.
Just stiff cables, basically.
Right. Now think about the human brain. It is not a static block of clay. It's a highly dynamic living organ. It literally pulsates and shifts with every single heartbeat.
Yeah, it's constantly in motion.
So when you insert a stiff, rigid wire into a pulsating organ, you are basically creating a scenario where a stiff cable is constantly scraping against the naturally moving tissue of the brain.
Which causes continuous microtrauma and inflammation just by leaving the device in there.
Exactly.
And the human body actively fights back against that kind of intrusion. That microtrauma is the exact problem NeuroOne set out to eliminate with their proprietary polymer architecture. Instead of relying on a stiff wire, they utilize an incredibly flexible, low-profile, thin film.
How thin are we talking?
So thin and so pliable that it actually conforms to the microscopic contours of the brain tissue. It floats and moves with the brain rather than fighting against its natural rhythm.
That makes so much more sense.
Right. And because the physical profile is so incredibly small, it enables what they call minimally invasive needle delivery. A surgeon can simply fold or spool this film into a standard surgical needle, navigate to the target area in the brain, deploy the film, and withdraw the needle.
Leaving almost zero physical footprint behind.
Exactly. Virtually zero.
I have to pause and push back on that, though. If a flexible, tissue-conforming thin film is so clearly the obvious holy grail for neurosurgery, why hasn't this been done before?
That's the million-dollar question.
Right. I mean, why haven't massive med tech giants, companies like Medtronic or Boston Scientific, who have literally billions of dollars in their R&D budgets, already built this and cornered the market?
Well, the engineering hurdle is just astronomically high. You have to remember the environment we are talking about. The inside of the human body is a wet, salty, highly corrosive, constantly moving biological war zone.
A harsh environment for electronics.
Exactly. Usually when you bond microscopic metal circuits to a flexible piece of plastic and then submerge it in that corrosive environment, while subjecting it to constant bending and pulsating, the physics just fail.
The metals just break.
Yeah, the metal traces delaminate, they snap, or they rapidly corrode. NeuroOne managed to solve this massive durability problem without sacrificing the flexibility of the film.
They didn't do it by just hiring fresh graduates, right? They went on the offensive.
Oh, absolutely. They aggressively poached top-tier talent. They brought in veterans from those exact legacy medtech giants you mentioned.
The ones who couldn't solve it.
Right. But they also pulled heavily from Neuralink, Elon Musk's brain-computer interface venture. So they effectively bridged the gap between reliable, scalable mass manufacturing and bleeding-edge neural interfacing.
Which leads directly to their ultimate competitive mode, It is not just the shape of the film or the fact that it survives the biological war zone. It is what the FDA actually allows them to do with it.
This is crucial.
Let's look at the monopolistic regulation aspect of their strategy. NMTC currently holds the only FDA 510(k) clearance for a single device that is capable of both high-fidelity diagnostic recording and therapeutic ablation.
And to appreciate how disruptive that is, you really have to look at the legacy workflow. Historically, a surgeon uses one device to map the electrical signals in the brain to find the problem.
Like finding the source of a severe epileptic seizure.
Exactly. Then they have to remove that device and undergo a completely different, highly traumatic procedure to actually destroy or ablate that misfiring tissue.
Two separate procedures.
Yes. NeuroOne shattered that workflow by building microscopic temperature sensors directly into the contacts of their tiny film.
And those sensors are literally the difference between a successful surgery and a catastrophic brain injury. Because when you ablate or burn brain tissue, your biggest enemy is what surgeons call thermal spread.
Yeah, you do not want that heat traveling.
No, if the heat radiates even a millimeter too far, you cause irreversible, permanent brain damage to healthy tissue.
And the built-in sensors change that entire safety profile. The system automatically modulates the energy output in real time, completely preventing dangerous thermal spread.
Oh, wow.
So picture this for the patient. A surgeon inserts this single microscopic film. They map the electrical activity to pinpoint the exact source of an epileptic seizure. They hit a switch to safely burn away just that specific pathological tissue. Then, without moving a single instrument, they immediately switch back to diagnostic mode to verify that the seizure activity is entirely gone.
So they diagnose, they treat, and they verify success, all in a single, minimally invasive surgery.
It is an absolute game changer for patient outcomes.
It really is. But, as anyone looking at an investment roadmap knows, it's one thing to have a brilliant engineering marvel in a lab.
Right. Totally different beast.
It's an entirely different thing to build a sustainable commercial engine. How does a company this small translate scientific breakthroughs into actual business momentum?
Well, you have to take a hard look at their operational leverage and how they are navigating their financial realities. And the numbers from their Q1 2026 reports tell a very compelling story.
Here's where it gets really interesting, because the operational leverage at this company completely defies standard medtech logic. I mean, when you think of a corporation managing 4 distinct FDA-cleared product families, you naturally picture a sprawling corporate campus with hundreds of engineers and sales reps.
Oh, easily.
But NeuroOne is managing all of this with a staff of fewer than 16 employees.
16. That headcount is a testament to the efficiency of a true platform technology. Once you crack the underlying physics of the thin film, adapting it to new medical applications doesn't require reinventing the wheel every single time.
Yeah, it makes sense.
And looking at those Q1 2026 financial realities, they are executing what is best described as debt-free scaling. They ended the quarter with a completely debt-free balance sheet.
Which is wild.
For a commercial-stage med tech company fighting in this arena, that is remarkably rare. They reported $3.6 million in cash on hand, and they boast incredibly robust 54.2% product gross margins.
That's huge.
And additionally, they successfully collected a $2.7 million receivable from their key commercial partner.
Let's talk about that key partner, Zimmer Biomet, because this is where the David and Goliath dynamic shifts into a symbiotic relationship.
It has to.
Right, a 16-person company cannot build a global sales force from scratch. They need an incumbent.
And Zimmer Biomet is an absolute titan in the orthopedic and surgical robotic space. Zimmer sells million-dollar robotic surgical assistants.
Those things are amazing.
They are marvels of engineering. They can navigate perfectly to specific microscopic coordinates in the human brain, but Zimmer recognized a critical flaw. Their million-dollar robot is only as good as the tool it is delivering.
Right. If the robot carefully navigates to the perfect spot, but then deploys a clunky, rigid, inaccurate legacy wire, the patient outcome still suffers.
Exactly. The precision of the robot is wasted by the clumsiness of the tool.
Mm-hmm.
So Zimmer opens their checkbook. They paid NeuroOne an $8.5 million non-dilutive licensing fee to secure exclusive distribution rights for this thin film technology. It is the ultimate razor and blade business model. Zimmer sells the massive, multi-million-dollar robotic hardware, the razor, and NeuroOne exclusively supplies the highly precise, single-use consumable electrode, the blade, for every single surgery.
And the synergy is already bearing fruit, isn't it?
Oh, yeah. The recent data shows that nearly half of all Zimmer's ablation patients were treated using the NeuroOne system in just the most recent quarter. That partnership is the bedrock of their financial guidance.
Right. The CFO established a firm baseline revenue target of $10.5 million for fiscal year 2026.
A solid foundation.
And for anyone analyzing this roadmap, it is crucial to understand that this 10.5 million target is driven almost entirely by just one product, the OneRF Brain Ablation system running through that Zimmer distribution channel.
But, the real question for an investor looking at a small cap isn't just about the baseline. It's about the ceiling.
Exactly. If 10.5 million is just the floor keeping the lights on, where does the massive exponential upside come from?
It comes from new markets.
Right. It comes from taking this proven thin film platform and aiming it at entirely new, massive total addressable markets, or TAMs, and their first major pivot is toward facial pain.
This is a brutal one.
Specifically, a condition called trigeminal neuralgia. For those who aren't familiar, this is a facial pain condition so excruciating, so agonizingly persistent, that in the medical community, it is notoriously known as the suicide condition.
Yeah, it's heartbreaking. And the legacy surgical approach for trigeminal neuralgia is barbaric. It involves a surgeon repeatedly stabbing a rigid needle into a patient's face, trying to locate the exact microscopic trigger point on the nerve through localized trial and error.
And the patient is often awake for this, right? Experiencing unimaginable agony with every miss?
Yes, it's horrific. But NeuroOne took their thin film and designed it to act as a paddle, covered in multiple independent electrical contacts.
Okay, how does that work?
The surgeon only places the paddle once, gently laying it over the general area of the nerve. No more multiple stabs. They just pull out a device and digitally steer the energy across the contacts until they find the exact right spot to block the pain.
That is incredible, and the initial results are stunning. In their limited launch of 9 patients, they reported a 100% success rate. 9 out of 9 patients reported being entirely pain-free.
What's fascinating here is how seamlessly they're taking that exact same paddle concept, proving it in facial pain, and aggressively scaling it up to target the $3 billion spinal cord stimulation, or SCS, market.
$3 billion?
Yep. They are aiming to launch their spinal cord paddle lead by late 2026 to treat chronic lower back pain.
The physics of the spinal application are brilliant, though. Think about traditional 360-degree spinal wires currently used in the industry. They're basically like a lawn sprinkler.
A lawn sprinkler.
Yeah, when you pump battery energy into them, they broadcast electricity in every single direction, upwards into the muscle, sideways, downwards. It wastes a massive amount of energy stimulating bone and tissue that doesn't need it.
Oh, I see, which drains the patient's surgically implanted battery incredibly fast.
Exactly. NeuroOne's paddle completely solves the lawn sprinkler problem. Because all the electrical contacts are isolated on one flat side of the film, it acts like a highly directional spotlight.
Focusing the energy.
Right. It points 100% of the therapeutic energy directly downward into the spinal cord.
So the efficiency gains are massive. It saves immense battery life, meaning the patient doesn't have to undergo surgery to replace a dead battery nearly as often.
But the real magic is how it handles neuroplasticity. The human nervous system is smart. Sometimes it adapts to the electrical stimulation, and the patient's pain returns a year or 2 later.
Which usually means another surgery.
With legacy wires, yeah, the doctor has to perform a revision surgery to physically move the wire. With NeuroOne's high-density grid, the doctor doesn't cut the patient open again.
Why, really?
Yeah, they just pull out an iPad in the clinic and digitally steer the electrical field to a completely different set of microscopic contacts on the paddle. It is software dictating hardware inside the human body.
That is wild. But even beyond pain management and spinal cord stimulation, we need to look at the ultimate pipeline play. The holy grail of their platform is their drug delivery technology.
Okay, drug delivery.
Yeah, they have engineered a microlumen, which is essentially a microscopic, flexible tube, directly into this sensor-equipped thin film.
We really need to pause and emphasize why this is such a monumental breakthrough for the pharmaceutical industry. Getting advanced drugs into the brain is incredibly difficult because of the blood-brain barrier.
The brain is effectively a fortress.
Right. It has a highly selective security system designed to keep toxins out in the bloodstream, but it also, frustratingly, keeps life-saving cancer drugs and gene therapies out.
Because of that fortress, when pharma companies want to test experimental therapies for deadly brain tumors like glioblastomas, they can't just give the patient a pill. They have to physically bypass the barrier.
And historically, how do they do this?
They do this using a standard dumb needle. They inject the experimental drug into the brain tissue, pull the needle out, And then they just wait. They wait months,
Mm-hmm.
relying on periodic MRI scans or watching for physical symptom changes to see if the drug is actually doing anything.
It's essentially flying blind.
Completely.
Huh?
But with NeuroOne's microlumen, the delivery tube itself is covered in high-fidelity diagnostic sensors. This means pharmaceutical companies can bypass the blood-brain barrier to deliver localized gene therapies, cellular therapies, or targeted oncology drugs.
And while they are physically infusing the drug, the sensors are recording the cellular electrical data in real time.
Let that sink in. They can literally watch the brain's circuitry react to the experimental drug at the exact millisecond of infusion.
That is mind-blowing.
It completely de-risks the billion-dollar clinical trial process. Pharma companies no longer have to wait months to know if a drug is interacting with the targeted cells. They get instantaneous, high-fidelity biological feedback.
Okay, so you have revolutionary technology bypassing the blood-brain barrier. You have 54% gross margins. You have a massive partnership with Zimmer Biomet keeping the lights on, and multiple shots at $3 billion TAMs.
Sounds perfect, right?
So what does this all mean for the stock itself? I mean, how does a company with this much undeniable potential find itself fighting for its life on the stock exchange, currently holding a distressed listing valuation?
Well, this is where we have to take off the rose-colored glasses and objectively analyze the severe market skepticism.
The risks.
Yeah, the corporate governance risks that are glaringly outlined in their proxy statement. The most immediate existential threat to the company is the Nasdaq Compliance Roadmap.
Right. The stock has languished below the $1.00 minimum bid requirement for far too long.
And Nasdaq doesn't care about your pipeline. They are facing a strict, non-negotiable deadline of May 4, 2026 to regain compliance.
And if they fail?
If they fail, they are delisted and forced down to the over-the-counter markets, the pink sheets. If that happens, their ability to raise capital and attract serious institutional investors virtually evaporates overnight.
So what's the plan?
To prevent that devastating outcome, the board is proposing a reverse stock split. They are asking shareholders for the authority to consolidate shares at a ratio ranging anywhere from 1:2 to 1:15.
Okay, let's break down the mechanics of this because it is highly dilutive. Think of it like a pizza.
I like pizza analogies.
To make the stock look more expensive and satisfy Nasdaq, the board wants to take your pizza that is currently cut into 15 slices and merge it into just one giant slice. Mathematically, the total value of your pizza hasn't changed.
Right.
The price per share goes up, Nasdaq is happy, the delisting is avoided. But if you read the proxy carefully, there is a massive catch.
The catch is the authorized share count. While the reverse split mathematically reduces the number of outstanding shares circulating in the market, the board is keeping the total authorized share count unchanged at 100 million.
Exactly. Going back to the pizza, they merge your slices to satisfy the exchange, but the board is secretly keeping the oven on and holding on to the right to bake up to 100 million more slices whenever they want.
Post-split, the board will have a vast, empty reservoir of authorized shares that they can issue at will to raise capital.
If you are an investor reading this proxy statement, this is the line that should make you sweat. It is a massive blank check for future dilution.
And the dilution warning doesn't stop with a reverse split. The proxy also asks stockholders to approve a significant expansion of the 2025 equity incentive plan.
What are they asking for?
They want to add 1.5 million shares to the employee pool, and more concerning to retail investors, they're adding a 5% annual evergreen provision.
Wait, hold on, let me get this straight. An evergreen provision means the equity pool automatically dilutes by 5% every single year just to fund employee stock options.
Yes, exactly.
As an investor, how am I supposed to stomach guaranteed annual dilution just so they can pay their staff?
If we connect this to the bigger picture, you have to understand the brutal reality of material science at this level. Severe dilution is the unavoidable cost of doing business.
Because of the talent.
Right. A 16-person company cannot compete with Medtronic, Boston Scientific, and Elon Musk's Neuralink for world-class, bleeding-edge engineering talent using cash. They simply don't have the runway. They have to pay in equity.
So it's equity or nothing?
If they don't offer competitive stock options, the talent leaves, the innovation dies, and the company folds.
That's a tough pill to swallow, but the logic holds. You are investing in the brains of the operation as much as the physical tech.
Furthermore, the market is severely pricing in what we call PMA regulatory risk. Remember that $3 billion spinal cord market we discussed?
The lawn sprinkler versus spotlight thing.
Right. To enter that market, you typically need to conduct a multi-year massively expensive pre-market approval, or PMA, clinical trial. We were talking upwards of $50 million.
And a 16-person company with $3.6 million in cash cannot afford a $50 million clinical trial. It's financially impossible.
Exactly. Therefore, NeuroOne has a very narrow path forward. They must rely on partnering with a larger incumbent company that already holds a spine PMA.
Oh,
But securing a partner, they can file a regulatory amendment to simply use NeuroOne's electrode within the partner's existing approved system, entirely bypassing the massive trial.
but the risk is binary. If they fail to secure that strategic partner, their entire multi-billion-dollar spine roadmap stalls out indefinitely.
Yes, it stalls.
Okay, bringing all of these complex threads together, the financial metrics, the massive TAM potentials, the Zimmer synergy, and the severe governance and dilution risks, we need to provide a definitive strategic outlook for you, the listener.
Well, based on the synthesis of these proxy filings, the financials, and the underlying technology, NMTC is rated as a high-H alpha small cap.
High risk, high reward.
It is an extremely volatile, high-reward setup. They have engineered an incredibly wide moat technology protected by monopolistic regulatory clearances. They are taking multiple, highly credible shots on goal across several markets that exceed $3 billion.
Right.
However, you are buying into a company that the market is currently punishing with a distressed listing valuation due to the impending reverse split, capital requirements, and regulatory hurdles.
But despite those undeniable dilution risks, if you look at the filings, there is a powerful counterweight that should catch any investor's attention. Massive insider alignment.
No, absolutely.
The people who know the science and the financials better than anyone else are aggressively buying in. Insiders collectively own roughly 11.8% of the entire company.
That's a strong signal.
Yeah, CEO Dave Rosa, CFO Ron McClurg, and Chairman Paul Buckman have all recently purchased stock in the open market using their own personal capital. And look at their recent strategic hire, David Wambek.
Right, for drug delivery.
Exactly. They brought him in specifically to lead the drug delivery division. He is a former investment banker who previously invested his own personal money into the company before he even joined the executive team.
Wow.
When the architects of the company are buying their own stock in a distressed market, that signals immense internal conviction.
This raises an important question, one that is not explicitly modeled on any current balance sheet, but which represents the ultimate long-term horizon for this platform.
What is it?
Consider the sheer volume of data being generated. As NeuroOne scales up their Zimmer partnership and their pain management lines, they will be implanting thousands and eventually millions of these permanent, high-fidelity read-and-write interfaces deep into human nervous systems.
Okay.
By doing so, they are inadvertently building a massive, proprietary real-time dataset of localized neurobiological responses.
Wow, so they're building a library.
Yes. In a decade, could the true astronomical enterprise value of this company lie not in the physical plastic and metal hardware they sell to hospitals, but in harvesting that unprecedented neural data for artificial intelligence to map, predict, and ultimately cure human brain disease?
It is a staggering thought to leave you with. The potential transition from a hardware manufacturer fighting for margins to the ultimate biological data company mapping the human mind. Risk defined. Portfolio protected.